Hi, my name's Rachel Allen and I'm an Aboriginal health practitioner. I'm here to take you through the 715 health check for Aboriginal and Torres Strait Islander infants and preschool children from birth to 5 years old. Let's start by going through what a good health check should include. A good health check is useful to the patient, identifies health needs including patient health goals and priorities, supports patients to take charge of their health and well-being, provides a framework for primary and secondary disease prevention through healthcare advice, risk assessment and other measures, is provided by the regular healthcare provider, includes a plan for follow-up of identified health needs, priorities and goals. You can also check and see through Health Professional Online Services or HPOS if a client is eligible for a health check. The information we are supplying is very comprehensive and may be overwhelming. Some of this information you may already have pre-existing knowledge of and may not need to ask all the suggested information. As a health practitioner, you have a legal obligation to provide patients or their substituted decision makers, such as parents and carers, with information including discussion of the process and benefits of their health check. Consent processes promote patient-centered care that is respectful of and responsive to individual patient values, preferences and needs, and ensures the patient's values guide all clinical decisions. Consent processes promote cultural responsiveness in health services, thereby improving the capacity to respond to the healthcare needs of culturally and linguistically diverse communities. As babies and children do not have the capacity to provide consent for health checks, you must gain consent from the parent or carer attending the appointment with the baby or child. It is also not uncommon for Aboriginal and Torres Strait Islander children who are in the care of their parent or parents to attend their appointment with another relative, such as grandparents. Children and babies may be represented through social services or are in out-of-home care and might attend their appointment with a caseworker with or without their parent or parents. In these cases, you may be able to call the parent or primary caregiver and confirm another relative has permission to give consent on behalf of their child. If you're unsure about a person's capacity to give consent, it's advisable to seek expert assessment and advice. When undertaking a health check, you may also need to gain consent for sharing information with relevant healthcare providers. For babies and children, this could include childcare workers, Aboriginal midwives and family support workers, fax workers, out-of-home care services or specialists. You should ask the parents or carers to provide the names of workers, organisations and the contact details of any other providers involved in the care of the child and document this in the patient's file. Particularly for babies, this may be the first time they've attended your practice. You may need to collect all their identifying data and create a medical record for them. For children who have already been to your service, you still need to ensure that all identifying data is up to date and correct. When updating patient details, you should ensure Indigenous status has been recorded correctly by asking the parent or carer, is the baby or child of Aboriginal or Torres Strait Islander origin? Young children and babies may not have a Medicare number yet. Take this opportunity to talk to parents and carers about the importance of registering children with Medicare. You could use this opportunity to help the parents fill out the form and send it to Medicare for them. Once a Medicare number is provided, you can also register babies and children for Closing the Gap PBS Co-Payment Measure, or the CTG, for cheaper prescription medication. As you begin the health check, ask the parents or carers, what are the important things for you in this health check today? Or, is there anything you're worried about with your child's health and well-being? This is a good way to gauge their priorities for the health check. You should also ask if they've brought their Blue Book, the baby's personal record, along with them. This is a very useful opportunity to ensure the Blue Book is up to date and you can update it as you move through the health check. Ask parents or carers, is there anything that you're worried about with your child's development? The NACCHO RACGP Partnership Program and Australian Department of Health have developed a table which can be used in identifying any red flags in behaviour and development for children aged 6 months to 5 years. It's helpful to ask parents or carers questions in line with the chart, such as for a 12-month-old, is your child starting to crawl or trying to pull themselves up on furniture? Or are they starting to babble and try and talk? Ask parents and carers, is there anything they're worried about with the child's behaviour? You could ask about how the child behaves at home. How do they get along with other children? If the child is attending childcare, you could ask if the childcare workers have any concerns. If the baby or child is in childcare or daycare, which daycare do they go to? Ask how often they attend. If the child is 4 or 5 years old, you'd expect them to be attending childcare or early learning centres on a frequent and regular basis to get them ready for school. Do they ever miss childcare? If so, how often? It's important to explore reasons for this, such as illness, lack of transport, or the parents or carers keeping them home. Is there anything the parent or carer is worried about with the child's sleep? If they're a baby, you would expect them to be sleeping a lot. If they're an older child, are they having naps throughout the day? What time do they go to bed and what time do they wake up? Are they waking up frequently during the night? For babies and young children, you should also ask about sleeping arrangements. Does the baby sleep in a bassinet or cot? Do they co-sleep with their parents? Do young children sleep in a bed, or do they co-sleep with their parents or share a room with a sibling? Do they fall asleep in their bed or on the couch? Do you have a monitor in their room? If parents or carers tell you their baby's co-sleeping with them, it's important not to shame them. Let them know it's safest for baby to sleep in a cot next to the parent or carer's bed for the first 6 months to 1 year of their life. However, be aware that parents or carers may choose to co-sleep for a number of reasons, including making it easier to breastfeed and resettle during the night, a sense of safety and security, or overcrowding at home. You should make sure parents and carers are aware of the dangers of co-sleeping and ensure they're minimising the risk if they do continue to co-sleep. Co-sleeping increases the risk of SIDS and other sleeping accidents. New parents or carers of newborns may also benefit from education regarding reducing the risk of SIDS and other sleeping accidents and may benefit from a referral to early childhood nurses or midwives. Ask who the child lives with, keeping in mind this may not always be the child's parents. You can ask about siblings or other relatives that may be living in or staying at the house. Have there been any stressful life events that would cause your child to be upset? It's very important to be sensitive and non-judgmental when asking questions such as this. Responses could include postnatal depression, traumatic birth, domestic or family violence, separation of parents, or removal of the child from family. If any red flags are raised here, you should document and report accordingly. Reporting can relate to violence, abuse, and neglect. The Department of Communities and Justice has a number of reporting lines. It's important to establish medical history or any current health problems. Ask the parent or carer, what was the baby's gestation at birth, 30 weeks, 40 weeks, etc. What was their birth weight? It's important for national KPIs to record this in the patient's file. Were there any complications during pregnancy? This could be gestational diabetes or mum having high blood pressure. Were there any birth complications? This could refer to needing an emergency C-section or baby being breech. Were there any problems after birth? This could include jaundice, extended stays in the hospital for monitoring, or oxygen therapy. Has the child had any hospital admissions after birth? Has the baby or child had any of the following? Recurrent cough or chest infections, recurrent ear infections, or other issues with their ears such as needing grommets. Does the child or baby have any exposure to smoking, such as their parents smoking during pregnancy, parents, carers, or family members smoking in the house or in the car? Acute rheumatic fever and rheumatic heart disease are notifiable conditions in New South Wales and must be reported to New South Wales Health. Ask about details of all other relevant medical history. It's important to include traditional or bush medicines or complementary and alternative medicines such as vitamins, as these may interact with prescribed medications. When discussing medications, it's important that you check if this medication is still required, if you're giving the appropriate dose, as this can often change as the child or baby grows, and that they're taking it when and how they're supposed to. An example could be if a child has been prescribed a preventer, are they taking this daily or only when experiencing side effects? And are they using a spacer to administer the correct amount? You may need to provide education about using and cleaning medical aids and ensuring the medication is taken as prescribed. You should always make sure patients' medication usage is documented in their clinical record. Recording allergies and adverse reactions is an important KPI and is also important when considering prescribing medications and therapies. Is the parent or carer aware of any allergies or adverse reactions the baby or child has had? Do they break out in a rash when they're given certain medication? Are they allergic to bees? Do they need an EpiPen? Ask about significant illnesses that have a strong familial predisposition, such as breast cancer, bowel cancer, prostate cancer, ovarian cancer, ischemic heart disease, diabetes, hypertension, stroke, or glaucoma. You should ask and include the age of onset if known. For example, Nan on mum's side was diagnosed with type 2 diabetes when she was about 50. She had to have a toe amputated when she was about 70. This family history gives you an idea of what your patients are at risk of and things to screen for and keep an eye on as they grow up. Is there anything the parent or carer is worried about with the child's eating? It's common for young children to be fussy eaters, but you want to make sure they're getting enough good stuff to support them as they grow. What is the baby's breastfeeding history? Again, you're not here to shame anyone. The best baby is a fed baby. But we want to know if baby was breastfed at any point, and if so, for how long. If baby's drinking formula, you could discuss how much baby is drinking and make sure they're getting enough to support their growth. Some babies may have allergies to milk and formula, so you'd need to make sure parents and carers know what to keep an eye out for. Have a conversation with parents and carers about age-appropriate eating for the baby or child. Talk about transitioning to solids, recommended fruit and veggie intakes, and avoiding sugary drinks. It's good to ask the parents or carers what the child normally eats throughout the day, or what they're packing in their lunchbox for daycare. Some kids may be eating meals at regular times, and some kids may be grazing. You just want to know that they're getting enough nutrients to support their growth. A question that you need to ask is about the availability of food. An easy way to ask this question is to ask, has there ever been a time when you've run out of food and haven't had enough money to buy more? If they answer yes, you need to help them find support. They may need a referral to a food assistance program such as Anglicare or a food bank. Ask parents or carers if there's anything they're worried about with the child's level of physical activity. For babies, you may ask about tummy time. Babies should be getting about half an hour of tummy time each day. For older children, you want to make sure they're getting enough physical activity. This could include playing outside, dancing, jumping on the trampoline, going for a walk with auntie, or playing at the park. Children aged 1 to 5 years should be doing 3 hours of physical exercise a day. Is there anything the parent or carer is worried about with their child's level of screen time? You want to make sure kids are watching good quality content and are balancing out screen time with lots of physical play outside or with their toys. It can be helpful to be mindful of the amount of time our kids are spending on screens, and it's good to encourage a break every 30 minutes or so. Is there anything the parent or carer is worried about with the child or baby's eyes? You're not just talking about their vision here. You also want to make sure babies have a red reflex and keep an eye out for squints and turns. Ask questions about conjunctivitis or weepy eyes. There are specialised visual acuity charts for children who don't know their letters yet. But if you don't have one of these handy, or you or the carer is worried about something, you can refer to an optometrist. Is there anything the parent or carer is worried about with the child or baby's listening? Does the baby or child respond to noises such as talking or loud bangs? This could just mean turning their head towards the direction of the sound. Does the child say huh or what a lot? Is there anything the parent or carer is worried about with the child's language or talking? You'd normally expect babies to be babbling at least around 6 months old and to start forming clearer words between 12 and 18 months. Parents may notice mumbling, yelling, or complete lack of talking, which could indicate some serious hearing issues. When was the child's last hearing test? Aboriginal and Torres Strait Islander children experience some of the highest rates of ear and hearing problems in the world. This can affect speech, behavioural problems, and education. Therefore, it's important for the kids to have regular ear tests at least 3 times between 12 months and starting school. Otitis media, or glue ear, and ear infections are common for Aboriginal and Torres Strait Islander kids, but you should also use otoscopy to look for wax, perforations, red or bulging eardrums, retracted eardrums, any discharge coming from the ear, and if the child has grommets, you should look for them and note if they've fallen out. If you notice anything abnormal or a parent or carer is concerned, you should refer them on to an audiologist or ENT. Ask the parent or carer if they notice any snoring or noisy breathing at night or when the child is sleeping. If they do, they may require referral to an ENT. Is there anything the parent or carer is worried about with the baby or child's teeth or mouth? When we're talking about kids' teeth, you want to talk about, are they brushing their teeth regularly? Are they using a soft, small toothbrush to get all their teeth and gums? It can sometimes help to have a stock of appropriate toothbrushes to hand out as part of your health checks. You want to make sure kids are using low fluoride toothpaste. Has the parent or carer noticed any dark spots, cavities, or rotting teeth? Has the child had a dental checkup, or when was their last checkup? Kids should see the dentist every 6 months. This is a good opportunity to have a chat to parents and carers about starting to brush the baby's teeth as soon as their first toothy pegs start poking through. They can start by using a very soft, very small brush with water to clean baby's teeth and gums to prevent decay and bacteria buildup. You don't just want to look at teeth. You should also be keeping in mind tongue ties for babies and asking about any bleeding or swollen gums, cold sores, ulcers, or rashes around the mouth for children. Babies can also be prone to oral thrush. Does the baby or child have any issues with their skin? This could include nappy rash, eczema, or dry skin, frequent sores, or sores that won't heal, or scabies. This is a good opportunity to have a chat to parents and carers about sun safety, sunscreen, and adequate protection such as hats. Health practitioners should use the Australian Immunisation Register to make sure babies and young people's immunisations are up to date. You also want to make sure the immunisation register matches what's recorded in the patient's medical record and blue book. If a baby or child is due or overdue for an immunisation, you can use the health check as an opportunity to administer this and update all records. If a child or baby is up to date with their immunisations, you can use this opportunity to remind parents and carers when their next immunisation is due. This is where you'll be taking babies and children's physical measurements. It's always polite to let parents and carers know that you'll need to touch their baby or child for these examinations, and that we weigh and measure babies naked. This is just a polite way of reaffirming consent and making sure parents, carers, and their children are comfortable. You should measure the baby's length or child's height, as well as their weight and head circumference. You can enter this information into their medical record and into their blue book. This information is always particularly interesting to parents and carers because they like to know what centile their baby or child is in. Most electronic systems have a way to calculate this for you, or you can use charts in the blue book. A child's height and weight are good indicators that a child or baby is thriving and growing as they should be. Cardiac auscultation, or listening to a baby or child's heart with a stethoscope, should also be done. Heart murmurs are common in babies and young children. However, it should be documented, monitored, and followed up appropriately. You can also use a stethoscope to listen to the lungs. Abnormal breathing sounds, such as wheezing or crackles, should be documented, monitored, and followed up appropriately. Abdominal examinations should be done to assess any abdominal pain or distension. You can examine the abdomen visually or gently with your hand while the child is lying flat. Abdominal pain can be caused by bowel problems such as constipation or infections such as gastro. It can be common to see hernias in babies, and this should be documented and followed up appropriately. You can also use a stethoscope to listen for bowel sounds. If the child is walking, you can examine their gait or the way they walk and move to assess their balance, coordination, and musculoskeletal structure. Gait abnormalities include bow legs, knock knees, in-toeing or pigeon toe, or flat feet. These conditions tend to resolve themselves as children grow, but should still be documented and monitored in case intervention is required. As part of a newborn check for babies less than 6 months old, you may also check for hip dysplasia. To finalise the health check, you should check in with parents and carers to gauge what they think are the most important parts to come out of the health check. You can reiterate the brief intervention and advice you provided during the health check, such as information and advice around screen time, safe sleeping, and developmental milestones. You should document any care provided as part of the health check, such as immunisations or investigations requested. You should talk to parents and carers about any needs or new diagnoses you've discovered through the health check and a plan to manage or treat these findings. You should consider what follow-up appointments need to be made, such as reviews or the next immunisations. If possible, you should encourage parents and carers to rebook for future appointments while you have them at the clinic. You may also be able to arrange transport to assist them in getting to the appointment. If you've made a referral to another specialist, make sure you remind the parents and carers why you're making this referral. It's more likely for someone to attend a follow-up appointment if they understand why they're there. Sometimes it can help the parents and carers if you can assist with booking the appointments for these referrals. This could be calling up a specialist on behalf of the patient while they're with you and booking the appointment for them. You should make sure you enter any recalls into the patient's medical record. This could include a date for the next health check, any immunisations due, or follow-up after a referral or investigation. To conclude the health check, you should always offer your patients, through their parents or carers, a copy of their health check report. Especially when talking about babies and young children, a copy of this report can be a good way for the parents and carers to communicate the outcomes of a health check to other services involved in the care of their child. Social services or out-of-home care workers will often request a copy of a health check report. Some parents and carers may decline a copy. That's fine, but you should still ask. Finally, you should claim a PBS item number 715 to submit the health check to Medicare and receive your practice incentive payment Indigenous Health Incentive. This concludes our module on Aboriginal and Torres Strait Islander health checks for infants and preschool children from birth to 5 years of age. Thank you.